Tell me about your approach to Medicaid in this budget. 21.7 million more. You're not actually asking for a specific cut like you did last year.
Well, I'll let Ann take the first crack at that, and I'll just give the bigger picture.
We are, you're absolutely right, recommending over $21 million in increased Medicaid costs. But in addition, we've been working with the providers as well as Health and Social Services to identify various cost containment strategies. And there is identified in this budget, there were also the two legislative committees that came up with recommendations. So while there are a number of recommendations that are out there that we will be considering as we go through the spring, both from the providers as well as the committees, we do have specifically a little over $4 million, which is less than 1% of the Medicaid budget, recommended, included in here, but we have far more than $4 million worth of ideas out there that we'll be considering.
You're going to find $4 million in cost containment. Is that?
We are proposing just over $4 million in cost containment specific items in this budget, which we'll be going through.
That will require JFC approval, or
if they don't want to approve it, they have to add the money back. That's correct.
Okay.
But there's, in excess of $10 million worth of ideas floating out there. Some of which came from the legislative committees, some of which is coming from the provider community, which will be considered as well, I'm sure, along with those.
Can you give us some examples of some of those?
Sure, absolutely. Both legislative committees recommended savings associated with managed long-term care. That amounts to about $2 million, so we have factored that into our budget.
What about the emergency room visits? That was a hot topic last
The
year.
emergency room visit limitation is not included, but we are including some recommendations on co-pays, therapies, prescription drugs, lab visits that make up basically the addition of that $2 million.
So we can get you that specific list, but the bigger issue here, as I talked about in the State of the State, is we've got to address how we as a state, as a purchaser of health care, can leverage that position. 40% of the people whose lives are covered under health insurance in Delaware are covered by the state, between Medicaid, state employees, retirees, and the like. And the idea that we can just keep on going the same old way, it's not true. We can't. And so, as I said last week, we really don't even have, and this is beyond Delaware, this is as a country, we don't have a health care system now. We've got a sick care system, and everybody's getting, there's incentives for people doing more procedures and more tests, and we have got to figure out a way, working with, and I feel particularly appreciative of the fact that both the Medical Society and the Healthcare Association being the hospitals, are already moving down this path to figure out how we can reward quality, how we can use the data that we'll get from a claims and cost database to figure out how to reward quality and reduce costs.
Governor, if the issue is as critical as you say it is, isn't it incumbent on you